Interesting. How often do you get sick?
Like really sick?
No, like a cold sick. Or cold or worse. Any kind of like infection.
Actually, I think I get the right amount, because I'm not a fan of people that tell me I never get sick. So if I get sick, I get really sick. I get fever 40 degrees. One day it's finished, like a little kid. I worked on this hard so that my immune system is kicking in like my kids do. And I would say, like this winter, everybody was sick, like all the time. I only had 1 day of a cough, of a nose. What is it? A stuffed nose. 1 day. Unfortunately, on a surgery day, but I had it 1 day. That's fine. And before, so I would say this year it was twice. I had COVID in the beginning, so I had COVID twice. That's why I also didn't need anything.
That's not bad.
COVID in the beginning.
What about before you were into biohacking and this kind of stuff? Like, how often did you get sick?
Like before I was this is like my whole life already, 20 years. And before I was also always sick, but I would always take antibiotics. That was the problem. I basically downward spiraled me. Now I'm happy when I get sick. So you can see it as when you're a parent, and I have 3 boys, and my wife is pregnant with the 4th one. So
wow, congrats!
Thanks, man. I see a ton of patients. I see patients. So I'm in contact with a lot of people, especially kids bring in different things. So kids are sick all the time. And it's actually good. This is their immune system training. I can give you a real life example here, because 2 of my oldest son is 8, the second one is 6. So they were born long before COVID. But the third one, Louis, is only born 3 months before or 6 months before COVID. So he's basically a COVID kid. That means he was never in contact with any kid. Therefore, now he gets it fully in. Now when everything is open, he is like sick all the time. And it's not a bad thing. But parents, please don't go to the doctor and give an antibiotic for every disease. Let them have their disease, their sicknesses. This is how the immune system trains. Only if something really bad happens, like you get a fever over 40, then you might need to interfere. But before this, fever is something very amazing of your body. Only 1 degree of higher temperature, 50% of the viral load is killed already. So fever is nothing to be afraid of. Actually, if somebody tells me, I never get fever, I never get sick, I'm like, oh shit, you're probably in chronic, it's called CDR, cell danger response. So your body is not even working at all.
Okay.
Yeah, no worries. You open doors for all bacteria and virus now living with you. Your immune system shut down. So
you're a dentist, and when I got my wisdom teeth taken out, they gave me antibiotics. I think that's part of the protocol, right?
It's mandatory.
Do you give it to your patients if you have to take out? You don't.
We do 1 single shot IV because it's mandatory, and the single shot IV doesn't go through your gut system. So it's actually okay for 3 hours. And we chase the single shot antibiotics straight away with a high load of vitamin C, magnesium, minerals, intravenous laser. It doesn't go through your gut
though. Okay. That's important to know. That's interesting. If I ever had to take antibiotics, I should not take the pills. I should get like some kind of IV or whatever, right?
I would get an IV. It depends on what you need, but you know how first pass mechanisms work and how little of the antibiotic after the liver gets to where it should go. Mm-hmm. So why not just shoot it and bypass everything and shoot it into your vein? Obviously, nobody can do that. That's the problem. That's why it's so easy to pop a pill.
No, what I'm saying, if you have access to an IV, that they can do that.
And you probably don't, if you need an antibiotic, maybe you do an IV, but there's so many things you can do. You can run high dose vitamin C, which is actually also working kind of like an antibiotic. You can do methylene blue. You can do so many things before you even need to consider it. But I also have to follow rules. That's the problem. So
regulations in Germany, you're saying?
Yes, but also obviously, so we are dealing. So over the years, my practice has evolved. Let's say 10 years ago, most of my patients came all over the world, because of being super, super, super chronic sick. Okay. They have seen 29 doctors before, and they were chronically Lyme patients, and they had Alzheimer's, Parkinson's, like all the nasty things, cancer. And they needed a 10 out of 10. They need all the root canals removed, the cavitations, everything. And we need to give everything. But now, over the years, it developed more into patients that are like you and me and health optimization. They look for the next edge. They also need a 10 out of 10. But it's different. And if you deal with something in your mouth, for example, you had a root canal, all the cavitations, like where they took your wisdom teeth out, you now have cavitations. I would bet 99% that you have it, and you will be on my chair and I'll help you get rid of it. Because these cavitations are a storage site or cave for anaerobic bacteria, even mold lives in there. So now
how do I know if I have a problem though? Sometimes, there's a saying, if it's not broke, don't treat it, right? So
yeah, it depends. We can just check it. You can see if there's
check.
We can check up front if you really have a cavitation. We do that. So I have an assumption.
What does a cavitation mean?
Cavitation basically means they took out your teeth. I'm just assuming you were in the teenage years, let's say 14 between 20, and you needed it to take it out so that your teeth don't get crowded. You're probably not prepared with the right lifestyle and nutrition, in hibernation mode, and they just did a massive surgery. So what happens afterwards is your body is just in shock, and big trauma is not able to properly heal bone. So it just grows tissue on top and the cortical part. But inside is mushy bone. And over time, it gets anaerobic, and these bacteria tend to live there. It's a storage site for toxins. They even find glyphosates in it, parasites, fungi, mold. So you have a cave of chronic inflammation combined with chronic infections in your jawbone, which is directly in your nervous system. And this part is central nervous system, small intestine, and heart meridian. So chronic fatigue, all issues you name, you can have, and you don't even know it. That's the issue about it. You optimize, and you're probably fine to compensate it. Why not? But I have one. My brother.
How do you know? How does somebody know that they have a problem there, though?
This is the problem. It's a chronic silent inflammation. You maybe had pain after the surgery, but at one point when your body has no solution for it, it gets kind of lazy and just down-regulates receptors. So it basically makes it quiet and you don't feel it anymore. There's a special condition of the cavitations called NICO, neuralgia-inducing cavitational osteonecrosis. These people really have massive trigeminal pain, migraines and stuff. So they should consider this. But 90% of all patients have no issues at the spot, but maybe can lift the arm, maybe have chronic gut issues, maybe have SIBO, maybe have chronic fatigue or thyroid issues or MS. There's so much studies about it because there's also a specific chemokine in these cavitations called CCL5. If you just Google scholars CCL5 and type in plus multiple sclerosis, you find 3,000 pages. And the problem is cavitations, or FDOJ, fatty degenerative osteonecrotic jawbone is what it really is not taught in dental school. It's just, for them it's woo-woo. So even go to your dentist, they don't even know about it. So why would they tell you? They can't.
Interesting. So what about, we were talking about antibiotics, and have you ever given your kids antibiotics?
Let me think about it. I would say no, but I'm not sure about Max. Carl and Louis definitely not, but I'm not 100%. I personally would never give antibiotics if it's not like life-threatening.
When's the last time you took antibiotics?
Only for my cavitation surgery, intravenous, but an oral antibiotic, the last time I remember was in dental school. When I was still unhealthy, I would take an antibiotic for everything, and I even smash it down with alcohol. I thought it's just a regular pill that you just always take when you feel not good.
Oh, wow.
I took so many, man. So like my microbiome really, it takes a lot to recover it, but it's getting better and better and better.
Nice. What are your top tips for better microbiome? Just like, spitfire them.
Top tips? Obviously, again, lifestyle nutrition is number one. Number two for the microbiome would probably really be check if you had these 3 killers because they interfere big time. And then obviously you can eat fiber, but this is lifestyle and nutrition. So you want to produce some short chain fatty acids. Oh, the sodium butyrate would probably also be good.